If you're feeling like a lump on a log, or meaner than a junkyard dog, you've got questions, well I do too. Come on and join the solution revolution. There's answers for me and you. Yeah, there's answers that we can use. Come on and join the solution revolution.
Welcome back again, everybody, to Mender Online. I'm Leo Battenhausen, and I'm glad you're back. Our last segment, we talked a bit about depression. I gave you quite an overview of some of the things it is and some of the things it isn't, and a few things of how you can treat it and work with it. But today I want to get a little more in depth on this thing called depression. Okay? Depression's been called the common cold of mental health. Why? Because it's so common, and what happens is a lot of people try to beat it on their own and think they can. And sometimes that works, sometimes it doesn't. But, I'm here to talk about what it is, what is a clinical depression versus a situational depression today. And we'll start there. Situational depressions can occur, and they do occur for all of us at any time in our lives. If we suffer the loss of a very close loved one, or a dog, or a pet, a divorce occurs, a job is lost, something sad or devastating happens to us, of course we're going to feel depressed. Our body is equipped to do that. Our brain is an amazing thing. We have what's called dopamine and serotonin. Those are the brain's natural antidepressants. And when things happen to us at a catastrophic nature, we will feel sad, and we will feel a bit helpless, and we will feel devastated. But the brain works on that, and that's why we have these dopamines and serotonins in our storage banks to distribute themselves to our neurons and get our brains back to regularly functioning after a certain amount of time, like a common cold, okay? It doesn't happen overnight, but we have to grieve, we have to get through it, and we have to see how we can, how much time it's taking to grieve and to feel that pain, and that's okay to do. There is no such thing as happiness as a constant. We will suffer when things terrible in our lives happen. That's okay. We should expect that to happen. Now, that's a situational depression, and those kinds of depressions, there is no textbook answer to this question, but how long should they last? Well, in my field, 2 months is probably a safe bet. If you're not back on your feet and functioning after 2 months following such an event or loss, you may need to seek out some help and see where you need to get your engine started again, and find out why you're stuck in this situation. So, the situational depressions, a breakup, think about it. How long should it last? They say time heals all wounds. It doesn't always heal them, but it helps us learn how to deal with them. And I say 2 months. Anything further than that, if you're still in that funk where you can't feel functional and you're still being torn down by the situation that happened, seek some help. You need to get some help on that and get you unstuck out of that situation. Now, a clinical depression, if there is such a thing, we talk about those things in our field. Some people call them chemical depression, clinical depression, major depression. Those are severe depressions, and they can happen either from a situational event or they can just happen. Some people are susceptible to these things for no good reason, or sometimes they are inherited in a family. They can be genetic in nature. So, but what a clinical depression is let's just say 2+ months passing of not being able to get out of bed, not talking to anyone anymore, not doing anything, not even trying to feel better, not wanting to feel better, thinking of killing yourself or suicide, just being completely immobilized to this depression thing. That's a clinical depression. And if you feel like jumping off the George Washington Bridge, that's a problem. And I would say that's very clinical. And that is definitely a call for help, and if not medication. Okay, we can't have that happening, although it happens all the time. And because people don't seek help for depression anymore. What they do, and let me get to this in a second, but back to the clinical depression, we just don't want to feel better. Sometimes it gets that bad where we just feel we're stuck, and we're stuck forever. To me, the severity involved in a clinical depression is such as that. We are beyond helping ourselves, and we are we're on dangerous waters when it comes to the care of ourselves. Definitely a call for help. And probably somebody else maybe needs to make that call for help. Okay? So, now, if anybody's wondering what depression is, this has really pissed me off. I've gone online, okay? We've all done this. If somebody thinks they're depressed and they do a Google search, what is major depression or what is clinical depression? 9 times out of 10, you know what's going to pop up before you there? Yeah, a pharmaceutical ad for antidepressant. What the hell is that? You're not getting an answer there. That's not the answer. But see how this gets fed into our minds sometimes. And sometimes people don't want to take medications, and that's absolutely fine. But if you're pulling up a Google search on what is clinical depression, which I did simply before this broadcast, and a couple of different sites and different wordings, everything that came up was an antidepressant. Now you can go try that yourself. But what is that to leave somebody thinking? That's not an answer. Okay, you're gonna shove a pill in my face when I'm looking to see what's wrong with me or my loved one. Okay, so, and we know by what the statistics of the World Health Organization that in 4 years, by 2020, depression is predicted to be the second highest diagnosed medical problem in the world next to heart disease. So if that's being the case, and pharmaceutical companies are cranking out antidepressants year after year after year, apparently they're not fixing this problem, are they? No. Why do we need new ones when depression goes up in statistics? 1 out of 3 people, I think it is depressed these days in either a clinical way or a situational way or a fictional way, which is another topic I want to talk about now. A lot of us are fed to believe that we should not be depressed. We should be happy all the time. Happy, happy, happy. Push a button, be happy. Take a selfie, be happy. Go online and be happy. Okay, that's not reality, folks. So, we can feel sad, and we can feel very alone in this world of technology. We are not meant to be that way. We are meant to be social. So, that being said, how many of us are walking around thinking we're depressed when we're just dissatisfied with our lives or the way the world is running around us? That may account for more than most of these numbers that the World Health Organization is talking about. I don't know. That's just my guess. But half of the world, to me, sounds very suspicious and very scary. 500 years ago, 50 years ago, we weren't running around with all this depression. What is happening now? Are we that spoiled as a nation or as a world that we want to run for the first pill to make ourselves feel better and happy, happy, happy? Everybody's happy. Bull. Okay, it's bull. We are allowed to feel depressed. We should feel depressed sometimes. You don't know happiness unless you feel sadness. We need to know the difference. There is no light without dark. Okay? There is no happy without sad. So running for a pill or a doctor's office, and they're just as guilty because they'll prescribe it in a minute, instead of trying to work through what is wrong with your life or why you're feeling sad, is really a disservice to yourself and a bonus to the pharmaceutical companies and perhaps the myth of depression. Okay? So it helps me to think about, and I've discussed this with clients of mine, it helps to think of depression, and I'm going to go through some of the symptoms again, but it helps to think of depression as an illness. Okay? Think about, diabetes. Okay? When a diabetic needs insulin, they know they need insulin. Their insulin's low, they can feel it. So what do? They go get insulin. If they're able to have it, and they're lucky enough to have it, they get their insulin and they get back to normal. Now, when you're feeling sad or depressed, that's your body or brain telling you, I need serotonin. I need some antidepressants in my head. Not antidepressant, well, natural antidepressants. I need some serotonin. Please, do something for me. That doesn't mean pop a pill, though. No, it doesn't mean pop a pill. It could mean, hey, make a phone call to a friend, get out in the sunshine, take a walk, go do something, pick up a book, do something that's going to, regenerate the dopamine in your brain and re-stimulate and create the antidepressants like insulin. It's a shortage of these natural antidepressants when we feel sad. So there are things we can do. And the more you do them, the less you need to have to think about doing them. We need to be more in touch with other people. The number one way to beat depression, hands down by far, is by helping other people. Imagine doing that these days. Nobody's really interested in doing that anymore. Maybe that's why depression is so high. But that's what does it, folks. We're being involved with others, being involved with other human beings, and feeling that purpose in life truly beats depression. But the other things you can do if you're not a people person is go out and take a walk in the sunshine, like I said, play with a dog, go to a park, do some exercising, make a phone call, anything to get your antidepressants juiced back up again. A pill is not always the solution. So, we really got to take a look at that. And if we're taking pills and not getting some type of therapy, we're also doing ourselves an injustice, because if pills are indicated and need to be taken, they are only at least 30% of the solution. The rest is your work and the assistance of a professional. When do you need to get help? Like I said earlier, 2 months into a depressive episode, if you're not past the feelings you're having of worthlessness or overeating, undereating, oversleeping, undersleeping, lack of socializing, lack of interest in leaving the house, lack of interest in anything, poor concentration, quick to anger, anxiety, these go hand in hand too. And if your loved ones are saying, are you okay? Is something wrong with you? You want to listen to them. But like I said, 2 months into it is my cutoff time where, I should make an appointment to talk to somebody. Our next episode after this, I want to talk about how to choose the right therapist. But this episode, I want to stay on this depression information and bring some light to this word and this feeling that we seem to hear every single day. Okay, and those are the things we need to keep a look at for, and understand it won't last forever. This is not something that will last forever with the proper care. Those people who decide to commit suicide are doing what we call making a permanent decision to a temporary problem. And it's very sad. And it's beyond sad because they probably haven't even sought out help. Maybe some have, but most don't. Most think it's not something they need to go get help for. But if you think of depression as we think of diabetes, it might help to understand better that, wow, I need to do something to get my neurotransmitters fired up again because I'm low on serotonin. So these are things we could do instead of sitting around wondering, how am I going to feel better? Why is my life so miserable? Nobody loves me. I'm a jerk. You think that's going to help raise your antidepressants in your brain? No. You're only going to fuel the fire of the depressive episode. So there's a lot that can be done, and there is a lot of help for people if you need it, and can make a world of difference. I want to do a shameless plug here. My book, Defeating Depression, The Common Sense Way to Find Happiness and Satisfaction, is right here. It has sold about 30,000 copies. It is available on Amazon.com and BarnesandNoble.com. Please pick it up. It's an affordable way to identify some things that might be helpful to you and what you're going through. Many people who have read that book, there's a lot of nice reviews on Amazon as well. But a lot of people who have read that book have told me, that book sounds like the story of my life. I saw myself in that book. To me, that's exactly why I wrote it. Because in my work, I think I've talked about this in the first video, I come across many people, and many people have the same problem. And it's a pattern, it's a theme. So I wrote this book in order to reach out to more people who I believe, no matter where you live, you're still going through these similar situations that cause depression in your life and how you can beat them. It's a matter of choice, folks, and in most cases it is. Yes, sometimes we do need antidepressants, but that's not the end of the world either. That doesn't mean a life sentence. It's not a death sentence either. It might be a life-giving opportunity. But we always want to try to go the path of least resistance first, and that is through therapy. Now, how much therapy should I take or should I go to before I know if I need antidepressants? A competent therapist will know and help you and guide you through that. My guess is usually 4 to 6 weeks of weekly visits. If you're not finding yourself getting some results, then if you're still stuck in that muckety mire of sadness and nothing is breaking through, you may want to consider seeing a doctor for a medical assistance. Because what antidepressants do in that case with therapy is kind of clear the air a bit and can clear the thoughts and the ugliness in the head so you can get to the real meat of the problem instead of being unhopeful about it or not caring about it as much, and clears that up. Sometimes the therapy alone will be enough to do that. A good reality check sometimes and a little encouragement and support goes a long way. But with the clinical depression, sometimes you need a little bit more than just the therapy. And what the antidepressants will do is help get you in a better position to be therapy ready. Okay? It's not going to make you happy. Don't think that's what antidepressants do. They just kind of put you back into a place of getting your serotonin leveled off and feeling like, okay, maybe I can do this. There is some hope here. Let me talk to this guy or lady. Let me try to make my life better. That's the important piece. And that's what we all want to do. So on that note, I hope I've cleared up a little bit more about clinical depression versus situational depression. When we come back next time, I'm going to talk about choosing the right therapist for you. And you will have a lot of fun with this one. One of my pet peeves, but I hope to give you a lot of good information and important insights into how to choose the right person for you to help you through the dark days. Okay, folks, for now, this is Mender Online. Please visit our website at mindmenderonline.com, mindmenderonline.com. And we are the Solution Revolution. I'm glad to have you on board. And my name's Leo Battenhausen, and we'll see you next time. Thanks.